So if we could just start by you introducing yourself by saying your name, your college membership status and your medical specialty, please.
Hi, my name is Hadiza Gachi. I'm an acute medicine consultant and I'm a fellow of the Royal College of Physicians of Edinburgh. I'm working in Nuneaton at the moment.
Thank you very much. So could you describe how the coronavirus pandemic has impacted on your working hours and your medical practices?
So especially during the peak, I was working full-time. All my SPA sessions were cancelled. So that's the main way that it has impacted it, because I was required to be in the hospital 9 to 5 every day, apart from the weekends. Since we passed the peak, that has changed a little. And since my colleagues have come back as well, because during the peak, some of them became unwell and had to be off for a while. So apart from that, it hasn't changed much. But with regards to practices, because of the need to cohort patients, we've had to work in different ways. So my ward used to be the red ward or the COVID ward. So we had to stay from the beginning of the day to the end of the day throughout on the ward, not mixing with other specialities. And now it's become like an amber ward, meaning it's people with low risk of coronavirus that are put there. So that has changed a little bit. And this means that now patients are being moved quickly. So as soon as their swab results come back negative, and if the whole bay is negative, then they are moved to other areas of the hospital.
Thank you very much. So have you experienced any shortages of medicine or medical equipment in your work? And if you haven't, do you have any comments on the shortages that people have experienced?
Yeah, so fortunately, we in my hospital, we didn't have any shortages of medicines or PPE, but it was concerning to see colleagues all around the country not able to access PPE at some points, and especially people in GP practices having to source their own PPE to enable them to see patients. So that was concerning, and we know that at the beginning as well, because of lack of PPE, members of staff became unwell, and some of them unfortunately passed away. And the concern for a lot of healthcare professionals is that before COVID hit UK, we'd been seeing videos of people from other countries wearing full PPE with the hazmat gear and everything. And the PPE that we were provided was just an apron, gloves, and a mask, which we did not feel provided us the protection that we needed. So calling it PPE, I think is a little bit of a stretch, but we had that anyway.
Thank you very much. So without giving individuals names, can you think of any particular patients' experiences which you could share which illustrate the complexities of treating coronavirus?
Yeah, there are so many really. So there, because as I said earlier, our ward was the COVID ward at the peak. So we had so many patients with coronavirus, and there were people that would normally have sent them straight to intensive care, but the intensive care was full at the time. And not only because it was full, but it was thought that maybe intubating them and ventilating them will not be the best for them because the outcomes were not great. So it was quite so almost, I would say, terrifying seeing the way that patients are awake when they're saturations go down. So normally when patients desaturate, they'll be maybe semi-conscious, but people were saturating about 50% and being fully conscious, and they're asking us to help them. So that was really really sad. And then we could only maybe give them some non-invasive ventilation, and they carried on for a few days, and eventually they just went. It was just not working, and they just died. So we had patients one after the other dying, sometimes in a day. You're finishing with one patient, and then the next one is, deteriorating and dying. It was like a Groundhog Day in some of those days.
Thank you. So, do you have any thoughts on what the long-term health effects of the pandemic might be?
So the effects of the pandemic will there will be the impact of those on those that got infected and maybe are suffering what we now call long COVID. So the symptoms that are persisting after they've had the COVID infection, and then there will be the impact on those that have other medical conditions. So, for instance, things like cancer and cancer investigations, cancer treatment, because a lot of um, procedures were cancelled and routine elective investigations and surgeries were cancelled. So there's a huge backlog of that. There's also the impact on patients with things like heart attacks and strokes who stayed at home because they felt they didn't want to burden the NHS, or they didn't want to get infected, so they stayed at home with their severe medical conditions. As we heard in the news recently, there have been a number of deaths at home. It might be people died of those conditions at home because they didn't want to come into hospital. So in the long term, I know there will be we need to be dealing with people suffering long COVID, and we need to try and catch up with treating people whose investigations and treatments have been delayed because of coronavirus.
Thank you. So, sort of following on from that, I wondered if it had any thoughts about the long-term impact on the NHS. So, do you think there will be changes to the way things are organised or the way things are structured? Or are there changes that may not happen but that you'd like to see?
Right. So one of the changes that I would like to see is staffing, because we know that before COVID, we had like international medical graduates struggling to stay in or struggling to come in because of the visa rules. So I think we need to get more people in to support the NHS, and also to expand the number of medical school places so that we get more homegrown doctors. I think one of the effects of that this COVID has brought is the development of IT in the NHS. I think I would love for that to be expanded so that people work more collaboratively, and the IT system is brought up to a world-class level. So in that situation, you'll see that if a patient, say in Scotland, comes to the UK, will be able to access their medical record, and that would be really fantastic.
Thank you very much. Do you have any comments on the way in which the government responded to the pandemic and the regulations that were brought in?
So I think initially it seemed as if the government was not taking it as seriously as we wanted them to take it at the beginning, and then suddenly we were told, okay, what needed to happen was a lockdown. But we've heard now that if the lockdown had happened earlier, 2 weeks earlier, we would not have had the number of deaths that we had. So that is really sad. And the even now the regulations that they're bringing in, they're not very clear. So people are getting confused. Do I travel or don't I travel? What do I do? Do I come back and the rules have changed, so I have to self-isolate? I think there needs to be a lot of clarification regarding that.
Thank you. So sort of following on from that, or similar question, do you have any comments on the way the public has responded to the pandemic, and particularly in the context of following these new regulations?
Yeah. So initially, I think the public was obedient. People stayed home mostly. Apart from that, the shops were raided and everybody was stocking up on a lot of food. People were obedient, and then people started to get tired, and started disobeying the rules, having parties, going to beaches, So that was a little disappointing, with people working hard in hospital, risking their lives, and people were doing what they wanted. And it was especially disappointing when a member of the government decided to travel from London to, up north, because they wanted some childcare support, which I think that made people, a bit upset. Yeah.
Thank you. So the next questions I'm going to ask are more about your personal experience of the pandemic. So just a reminder, if there are any questions you don't feel comfortable answering, please just say so, and I
Yeah,
won't
that's
press you on them.
okay.
So have you had, or do you know of any colleagues, friends, or family members, without giving people's names, who have personal experience of contracting coronavirus? And if you're comfortable doing so, could you describe those experiences?
Yeah. Well, I have had lots of colleagues become infected. Fortunately, none of them lost their lives in my hospital. One of the things that was so concerning was one of my colleagues who came in quite unwell, very breathless, desaturating, and we started him on high flow oxygen, then needed to start him on non-invasive ventilation and take him to intensive care. Fortunately, he did not require intubating, and he came out of it, which was really, really reassuring. At the beginning of the pandemic, I didn't test positive, but the first patient in my hospital that was found to be positive, I had seen the patient, not knowing they had COVID. Because at the beginning, we were just told to ask people for travel history. We didn't realize that community spread had already started. So the patient I saw hadn't traveled anyway, it seemed to have got it from the community. And I'd seen him thinking he had pneumonia with renal failure. And then I had a call a few days later saying, oh, the patient you'd seen is positive, you need to self-isolate, you need to arrange to be tested. So I had to do that. I had to start self-isolating at home. And I did have some symptoms, including at the time I had loss of taste, which wasn't even one of the symptoms that were being looked at the time, because I was having something like, crisps, and I couldn't taste them, and they tasted like cardboard. And I was wondering what was happening. But anyway, my test came back negative, but we know there are false negative tests. As soon as I tested negative, because the rules were different then, I went back to work. And then after subsequently, colleagues started falling, to the disease, right and left. And that reduced the number of staff we had around to care for patients. And that increased the pressure on us, really, on the ones left behind, yeah.
So my next question, you've answered sort of a little bit already, but I'll ask it in case you have more. Can you describe a bit about how your home life routines have been impacted by the pandemic and the lockdown?
Okay, so the impact on the of the pandemic is that, when I come back from work, nobody is allowed to touch me. So I make a beeline for the bathroom, strip and have a wash, and then wash those items, and then before making contact with people. Um, for me, I'm a single parent. My daughter was so worried about me. She's just 14. She used to wake up in the middle of the night, sometimes twice during the middle of the night, to come and check that I'm still alive and breathing. And it took a lot of reassurance to get out of that cycle, because she was scared that I was going to died during the night from the virus. Yeah, so, and then at the time when, because of the pandemic, people were hoarding food. So there was a time that we were actually scared we were not going to get any food, because I went to like 5 different stores, major stores, and I could not find food. I couldn't find anything to buy because people had bought everything. And it was only when the shop started giving slots to NHS staff that I was able to get some food for us to eat.
Thank you. So given everything you've said about the impact of coronavirus, professionally and personally, do you think the support for medical practitioners in terms of mental health is sufficient? And do you think there's anything more that should be done to support physicians and other workers?
So I won't be able to speak for other like hospital trusts, but my trust put in place a trauma risk management program. And although that wasn't put in place until after the peak, it started running anyway. And I think they also had the chaplaincy service coming to support the teams that saw a lot of death. And we're also given well-being areas and things like that to go and relax. But it has been a really stressful period of time, and more stress might be coming. I think in general, there should be access to psychologists for healthcare professionals and other staff in the hospital to be able to access, to give them the support that they need to deal with the trauma of dealing with so much death and illness from COVID patients.
Thank you. So just finally, where do you look for accurate information on the pandemic? And do you have any thoughts on the role of social media and the internet in sharing information with the general public?
Okay, so what was the last bit?
The role of social media and the internet in sharing information. So whether the information that is being shared about the pandemic is accurate,
Okay.
and whether that is a good way of sharing information about the pandemic.
Okay, so I look for information on my hospital intranet, because they have a twice weekly COVID update. And I also look on Twitter. So I follow the PHE on Twitter, Public Health England. So I get information from there. And I think that's a good source of information even for the public. I think things like maybe Facebook, sometimes you have a lot of false information. And I've had to be debunking lots of misinformation that is falling around, lots of conspiracy theories that are going around on Facebook, on WhatsApp, and things like that. So I think those organizations like the PHE need to continue to use those social media sites to give accurate information to people.
Thank you. So just before we wrap up, is there anything that you would like to say, or any way that you'd like to conclude that you haven't had a chance to bring up already?
Yeah. So COVID-19, we were not expecting this at the beginning of the year. We started 2020 with all enthusiasm, hoping for a fantastic year, and it's thrown this to us. It's changed some things, a lot of things negatively, but there are some positives. So, for instance, things like being able to access online conferences, So I was able to attend a conference while I was driving my daughter to athletics. I think that's fantastic, because otherwise I would have had to arrange someone to look for her and travel to the venue where the conference is going on and book a hotel and things like that. So there are some positives, and I think that that maybe this is the way to go.